you don't have to be an airway expert. If you take cone beams on several patients, what you're going to see is a difference in the airway, this dark space right in here. And if we can see the relative size of this airway versus this one, what's going to happen is we're going to get a feel for what's healthy or unhealthy. Maybe we would be tempted to ask a question like, do you snore at night? And if there's any signs or symptoms of a severe problem, send them for a sleep study, or at least to their doctor to be evaluated. Now, we can't diagnose sleep apnea, but we can certainly help people with airway problems to get the proper help, and possibly we can get training and treat it as well.
Excuse me, Dr. Julian, can I ask a quick question that came in? This is Amanda.
Yes.
I had a question that got a message to me. The question was, are there norms for airway? Like, obviously we see a bigger one and a smaller one, but how do we know if it's within normal limits?
So the limited training I've had so far tells me that an airway that's 10 millimeters is very normal and a good, healthy airway. I've seen airways 10, 15 millimeters wide.
That's in diameter?
If I take the narrowest point of this area right here and measure it, that's what I would consider the most critical point. So if this one right here, it looks like about 2 millimeters, maybe 2 to 3, then that would be an indication of a constricted airway. We would also look at it from an axial point of view to get a feeling for the three-dimensional view of that airway, because we're only seeing one dimension. It might be long and skinny, or it might be short and skinny. So total volume is what we're looking for. 10 millimeters is very good. 5 is not as good, but is it in an older adult, maybe with a little bit of extra weight, or is it in somebody much smaller, much younger? So part of it is how big is the airway, what's the age and health of the patient, and then we look at the nighttime habits as far as breathing and whether we have disordered sleep breathing or not. So there's a lot that goes into it. It isn't just one measurement. But this does give us a pretty good idea of healthy versus not as healthy. A comparison.
Thanks. Go ahead. Sorry.
Okay. That was a great question.